first time in their lives, these children will have access to world-class medical care, starting with reliable, centrally stored medical records. And the more information we gather, the more intelligent and effective the system will become across a vast spectrum of medical needs and services, not only dentistry and optometry. We found that in these communities, children were falling far short of their potential at school because they didn't even know they were struggling to see, or in other ways, battling with their health. Now, with these state-of-the-art mobile clinics, we can give the gift of clear sight, take growth measurements, build a medical record, deliver immunizations and vaccinations, and deal with dental problems much more quickly, and all at significantly lower cost.
So schools play a critical role in promoting the health and safety of young people and helping them establish lifelong healthy behavior patterns. Now, establishing healthy behaviors during childhood is easier and more effective than trying to change unhealthy behaviors during adulthood. Now, research shows a link between the health outcomes of young people and, of course, their academic success. Now, to have the most positive impact on the health outcomes of young people, government, community organizations, schools, and community members must all work together through a collaborative and comprehensive approach. Today, then, we discuss school health. We'll be joined in studio by the Deputy Director of Integrated School Health, Adolescent and Youth Health Programs from the National Department of Health, and a retired head of pediatrics and child health from Wits University, a nutritionist and an educational psychologist, and of course the general manager for mobile school health. Now, you may want to be part of the show by asking the panel some questions or just sharing your views with us. In that case, the number to call is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk, or simply just interact with us on our Facebook page, SABC Health Talk. Now, sit back, relax, and learn from this bumper show ahead. Coming to you just after a short break. I'm Dr. Sello Mutaung, and this is Health Talk. All right, welcome back. Now,
school children can experience several health problems such as poor oral health, some infections such as chickenpox, and mental health issues such as ADHD. Whenever children are together, there is a chance of spreading infections. In order to reduce the risk of becoming sick, your child must be up to date with the recommended immunizations. Even though your child has had immunizations, he can get infectious diseases common in children, such as coughs, colds, and sore throats. Research shows that majority of children in schools have as many as 8 to 12 cases of colds a year. According to the World Health Organization, school health programs are a combination of services that ensure that the mental, physical, and social well-being of learners is well taken care of. Paying special attention to children's health will improve not only their survival, growth, and well-being, but also their learning outcomes and development. The introduction of the Integrated School Health Program will allow learners in foundation, intermediate, senior, and further education and training to access a variety of health services.
Services will be provided by school health teams, each led by a professional nurse. In the early phases, services will cover environmental and personal hygiene, especially the importance of hand washing, healthy eating, the promotion of physical exercise, and safety. Health professionals will also check the ears, eyes, immunization status, and the nutritional status of children. In the intermediate phase, attention will be paid to mental health issues, including depression and suicide. In 2009,
during the Integrated Health Program launch in 2012, It was further announced that a number of health professionals have already been trained to monitor children's health in schools. Information on HIV, AIDS, sexual and reproductive health will also be introduced in South Africa's public schools.
All right, welcome back. Now, that's obviously a clip that was at the launch of the Integrated School Health Program. And we're going to learn more about school health. And my two guests for now in the studio is Feni Mutwani, who is Deputy Director of Integrated School Health, Adolescent and Youth Health Programs, or simply put IHSP from the National Department of Health. Welcome to Health Talk, Feni.
Thank you and good morning to our viewers at home. All
right. And next to Feni is Professor Peter Cooper. Prof. Cooper is the retired head of pediatrics and child health at the Wits University, joining us. He's also director of the African Pediatric Fellowship Program. Welcome to Health Talk, Prof.
Thank you very much.
All right. Perhaps let's start with you. I mean, this is that time of the year children are pretty much settled, at school. Some of them started school, last week. And clearly parents should worry, or at least should know about the importance of healthy children during their schooling time, because surely that has an impact on their schooling. Now, perhaps let's start by defining, or at least describing, what those possible health challenges might be for children at school-going age.
Yeah, well, I think the clip that was shown previously highlights some of the issues that children can have visual problems, hearing problems that have not necessarily been detected. Mm-hmm. So that sort of screening is very important.
Right.
But in a, excuse me, in any crowded situation, infectious diseases are always a problem.
Right.
So we have what used to be termed childhood diseases such as chickenpox, mumps, and even measles, which is something that we immunize against.
Right.
There are a certain number of children that don't respond adequately to the vaccine and are therefore susceptible at a later age. And then obviously the common viral infections that are going around, coughs, colds, flus. And as children get older, then we start looking at sexually transmitted diseases as they get into adolescence and beyond.
Right.
So infectious diseases generally are a sort of major issue.
Talk about infectious diseases. I mean, we're dealing currently with this problem of the outbreak of listeriosis. Should parents who have children at school worry about this?
No, I don't think so. It is what seems to be a food-borne disease.
Right.
But it mainly affects people who are immunocompromised. Their immune system is poor, and particularly very young infants in the newborn period. So, in fact, the majority of the cases reported have been in babies under the age of 1 month.
Right.
Normally, healthy children and adults, one would never say they can't get the disease, but their chances of getting it are very slim.
Yeah.
And there's not very much you can do about it to prevent it, because at the moment the food hasn't really, the source of the food hasn't really been identified. So we don't know. It could be anything that is on the shelves or in the markets.
Right. And how common are these other parasitic type infections? I mean, you've obviously described some of these common infectious ones, yeah?
I think they are common, but much more particularly in the rural areas where children perhaps are more exposed to animals.
Right.
But by and large, I presume you're talking about the sort of bowel parasitic infections.
Yeah. But also some that are normally found in hair, kids' hair. There's also talk that as parents they must check their children's hair, that sort of thing.
Well, those things are usually pretty obvious, and once they're detected, they should seek advice.
Right. And then in the clip that we showed at the launch of the Integrated School Health Program, there was mention of mental health issues affecting children. How common is that?
I suppose it depends how you define it.
Right.
But I think it is a very important area, and perhaps something that in the past has been somewhat neglected. And it ranges from children who have their own problems, perhaps coming from home, children who might be subjected to bullying at school. Childhood depression is an issue. And then some of the issues of mental health may be transmitted into into physical problems such as children not eating, not eating properly, bulimia, those sorts of things. So, by and large, they're things that everybody who deals with school children needs to be aware of, and perhaps pick up the early signs so that they can be managed at an appropriate time.
Okay. Fanny, let's come to you now. I mean, we showed that, obviously it's an old clip, deliberately so, because I think it was an important moment, in our history, when it comes to the health of school children. The launch of the integrated school health program. Just take us back a little bit and take us through the rationale behind this program.
Okay, thank you for that. Actually, the clip is still very much relevant because that was in 2012 when the policy, the integrated school health policy, was actually launched by the Honorable President there, and the policy itself is actually co-signed by both Ministers of Health and Basic Education. And of course, the Department of Social Development is actually on board, because you can appreciate the aim of the policy here was the provision of the comprehensive and integrated health services taken to schools. Like Prof has indicated, the program envisaged to actually capture some of the health issues that might have slipped parents at home, and then the specific aim thereof is to actually promote health, and also looking at the prevention of any barriers to teaching and learning. So the clip is still very much relevant because it embraces the whole program of the integrated school health program.
Okay. And what was the rationale behind getting all these different departments, I mean, social development, basic education, health? I mean, it may be obvious, but, let's just bet it once and for all.
Okay. The rationale this time around is that this policy in 2012 was actually replacing the 2003 policy. The initial one was actually health-driven. So when it was reviewed, research has showed that, it was not well accepted because there was poor collaboration between the departments of health, social development, and basic education, whereby when a school health nurse would schedule a visit to a school, but then you find them they are not well received at the school. So then that policy was relooked, and then a better, streamlined approach was then taken to have the three basic departments collaborating and providing these comprehensive services.
Okay. We hear that there's different phases of this program. Foundation phase, intermediate phase, if I'm getting that correct. Can you perhaps just briefly describe the different phases that this program has? And perhaps the timelines into which,
Okay. The different phases actually talks to the approach of how the program is offered in schools. So when we talk about the foundation phase, we're actually targeting learners from grade R to grade 3. And what happens here is that, your learners at grade R, they are exposed to the school health program, where they are assessed for all these barriers of teaching to learning and teaching. And then once they are screened, then the school health nurse will have the profile of a learner. But if such a learner has missed, the screening in grade R, then they will receive the service in grade 1. And then we go to the intermediate phase that looks into grade 4 and grade 6. And the senior phase is targeted for grade 8 to 10, and then further education and training, it relates to our learners in grade 10 to grade 12. So what the program specifies here is once per educational phase, at least a learner should receive, health services. So we'll be targeting your grade R and 1, your grade 4s, your grade 8s, and the grade 10. Yes. Okay,
of course, we're going to go into a lot more detail in terms of what actually happens in each of those phases. But for now, time for a quick commercial break. When we come back, we continue our discussion on school health. Please stay with us. Okay, welcome back. We're talking school health with my guests. First up, Deputy Director, Integrated School Health, Adolescent and Youth Health Programs from the Department of Health. Geez, that's a long one. IHSP, Feni Mutswana. All right. And of course, Prof. Peter Cooper, who is the head of, or retired head of Pediatrics and Childhood from Wits University. And we're now joined by another special guest, and this time, Romy Helsinger. Romy Helsinger is General Manager of Mobile School Health. Welcome to Health Talk, Romy.
Thank you, and thank you for having us here today.
All right. Before we start talking about this, let's take Danny on the line from the Val. Danny, welcome.
If you can push it up a bit, I'd appreciate it.
Danny, are you with us?
Yes,
No.
I'm with you, sir. I don't know maybe if you can hear me.
Yeah, we can hear you.
Yes, good morning, all of you there. So
Morning.
my question to you guys regarding this school health, I'm one of the data capturing the valley here working with school health. So there's an app that is being conducted by the Department of Health regarding this HPV. So now there is a gap between Department of Health and Department of Education. So I don't know maybe if there is a combination or maybe the relationship that is going to be there in forward for school health and Department of Department of Health and Department of Education to be one thing. Because now there is an app that needs to be working together with a clinic when the child is being given that dose for HPV,
All right.
then that thing needs to be in the system. So we struggle to get hold of Department of Education. So I don't know maybe if these people are buying the
right.
idea of implementing that.
Okay, thank you very much, Danny. Thanks for the question. We unfortunately don't have the Department of Education. We actually had the Department of Education in our show last week, but perhaps Department of Health may want to comment on that. You know, the relationship between, obviously, the two departments, health and education.
Yes, thank you for the question. Actually, we've got that strong relationship. As a matter of fact, the HPV vaccination program, it's a health-driven program, but of course, since it uses the integrated school health program as a platform, because it's only targeting your grade 4 girls, you know, that are given the HPV vaccination. So there is a strong relationship. Currently, there are trainings in provinces because the first round of HPV will be starting on from the 7th of February up to the 16th of March this year. So we've got a strong relationship between the Department of Health and Education. But when he talks about the app, it's actually the tablet that is used by the school health nurses or the HPV vaccination teams to capture data after immunizing learners. So I'm not sure in terms of the challenges, the specific challenges that he relates to, but then in terms of the relationship, we are working well, and that data is actually available because it's collected through the tablets and processed within the Department of Health and shared across all levels.
So perhaps you obviously will take note of the
Yes.
complaint and in your regular interactions with Department of Education, perhaps raise that. Let's come back to our subject and maybe start with Prof. Now, we mentioned in our last segment, you know, all these various health challenges that are possible. Let's just talk around the rationale behind screening for these things. You know, why is it important that we screen for all of these conditions? Is it that perhaps there are many of these kids who don't know what they have?
Yeah, well, I think particularly hearing and vision.
Right.
The children can be very poor, their hearing can be very poor, and yet they are not aware of it, and their parents and the school may not be aware of it either. So, and that obviously is going to impact significantly on their ability to learn. Similarly with vision, short-sightedness, for example, often commences in early to mid-childhood. And so children may not be able to see the blackboard properly or read off the blackboard or whatever other device is being used.
Okay.
So these are very important. And then other screening things would be picking up other health problems.
Okay. Before we hear from Romney, in terms of the integrated school health program, what are the, have you pronounced on any screenings that are mandatory or recommended perhaps at school level?
Yes, actually the oral health, vision and eye health is basically the screening. We call it the package of service that is offered to learners. So that is part of the package, including your nutritional assessment, the assessment of your fine gross and fine motor, you know, if there's coordination, especially in your young kids. And of course, the policy also talks about the sexual reproductive health, which is currently we are doing education and mental health screening.
Okay. So how widespread is the screening? Is it all the schools in the country or is it some of the schools?
When the program started in 2012, we were actually targeting quintile 1 and 2 because the schools are actually grouped into the quintile system. So it was looking at the poorer schools, but now currently the program is saturated up to quintile 5 and even the special schools. But of course, the issue of the human resources, because it's not all schools, so it's only schools that are prioritized and are identified by both the Department of Health and Education that are visited. Okay.
Rami, we need to give you a chance to tell us about what actually you do. But before that, let's take a quick call from Danny, Koos. Koos, welcome to Health Talk.
Morning. My problem is I've got two kids. One is in high school and the other one is in primary school. Now, the problem is that under pressure, when it's time for exams, they lose focus, right? And the other one is in primary school. He's now grade 6. He can't read, he can't write. You know, every year they have to pass him over like to another grade. And it's worrying for me because what I want to know is, isn't there a school that can, or a place that can help them to develop because they are very slow?
Okay, all right. Thank you so much for those very important questions. Fortunately, we are going to be dealing with these kind of issues, not in the next segment, but in our last segment. So just stay tuned. We will definitely address your questions. Robbie, let me come back to you. What exactly do you guys do with mobile school health, and what brought this all up?
Sure. We believe that basic preventative health care is a human right. Professor was saying 80% of all learning takes through a learner's eyes. So you can imagine if he can't see the blackboard, essentially he's going to get lost in the school system. You know, seeing or eyesight or poor vision is the difference between being literate and illiterate, employment or unemployment, and ultimately has a huge ripple effect on the economy. We created a preventative schools health program in line with the integrated schools health program, in line with government, to create a solution that addresses optometry, preventive optometry, PHC, and dentistry. We do this not in the form of a brick and mortar, but we do this in the form of a mobile clinic. So it actually looks like a big bus. Right. In actual fact, it's not a big bus. It's a 4x4 truck. It is geared towards going on tough terrain, hard to reach places, etc. And what we do is we basically take the services to the schools. Well,
to which schools?
To which schools?
Which schools do you target? Only rural areas, or do you go to urban areas? Where do you actually go?
Rural and urban, and we do work very closely with the Department of Health in order to show, in order to tell us which schools we do go to.
Yeah, give us a sense of what you've picked up so far, and how long have you been running this, by the way?
This project, this solution, is 9 years old.
Right, and what have you picked up? What's your experience over the years?
The reason why we believe that mobility is the answer to it's a simple solution to a very big problem. at the end of the day. We take the solution to the school. So we staff our mobiles. Each kid gets to see an optometrist, a PHC nurse, and a dentist. If the kid there and then needs a pair of glasses, we'll give it to him there on the spot. The kid gets to choose, the child gets to choose their glasses, and we just clip in the frames. So and then in PHC we do immunizations, motor skills, general BMI, etc. We've got a strong linkage to care. If it's something that we can't cover, we do refer to the local clinics, etc. And then in our dentistry sector, we can do extractions, we do fissure sealants on all the child's on their molars, etc. So it's literally bringing the solution to the school. Yeah. The reason it's successful, the kids don't need to leave school, the parents don't need to take 1 or 2 or 3 days off work, which is loss of income for the parents. And a lot of these children will never have a medical record per se, right. And we create these medical records
So you are making a very meaningful impact in there. All right. Well, thank you so much for your time.
Thank you.
All right, guys, time for another quick break. When we come back, we continue our discussion on school health. Please stay with us. Welcome back. So nutrition is another very important aspect of total health in a school child. And here to talk to me about it is Feni Mutswani, Deputy Director, IHSP from the National Department of Health, and Prof. Peter Cooper, retired Head of Pediatrics and Child Health from Wits University. And in our Cape Town studio, Nicole Jennings. Nicole Jennings is a nutritionist from Pharmadynamics. Welcome to Health Talk, Nicole.
Thank you so much. It's a pleasure to be here.
All right, we're going to come back to you just now. And perhaps let's start with Feni. From a department's integrated school health program perspective, there is obviously talk, and there's a whole segment dedicated to just nutrition. Just take us through that.
Oh, okay. Yes, with regards to nutrition, what happens is the Department of Basic Education has actually got the National School Nutrition Program. You know, that's operational in your quintile 1s up to quintile 3. But then what happens from the Department of Health, we're also looking at the nutritional state of the child, where during the school health program, some of the on-site services is health education. So health education starts with your hand washing, you know, toothbrushing, and especially also the nutrition, what to pack for your child for lunch box, your school vendors, your tuck shops in school. But from the Department of Basic Education, they actually have got guidelines that governs the management of your tuck shops, because you can appreciate that the school health nurses are not in schools every day, but then the parents, the school governing body, and the school-based support teams have to see to it that, you know, children are offered good nutrition and even in tuck shops to oversee what is being sold and being monitored.
We're going to come back to that issue of tuck shops because it's quite a controversial one. But Prof, I'm sure you'll agree with me that obviously nutrition plays, just apart from anything else, on the health of a child. That a child that's malnourished would never be able to learn.
Yeah, I think that's absolutely correct.
Right.
And sometimes we're seeing the effects of, by the time children get to school, of earlier malnutrition, and that is also a problem.
All right.
But obviously at the school, one wants to just optimize nutrition for optimal learning.
Absolutely. Let's take Lindy on the line from the West End. Lindy, welcome to Health Talk.
Good day. I just wanted to ask them about the health. We only see the nurses who are coming to the schools when they are coming with the campaign. But with the screening of children, the children are never screened at the schools, especially in Soweto and Roodepoort. We don't have school nurses.
Okay.
We've got local government nurses who come for campaigns. Number two, there are children who are at private school. They don't got this HPV, and it's so expensive, 1,000 something some of the children are taken there to those schools, not by their parents, but because they don't find schooling in the public school. You see?
Okay, all right.
So I just wanted to know.
Yeah, two very important questions. Perhaps Fanny would like to respond to those?
Okay, yes, thank you. Like I indicated earlier on, the provision of school health services depends also on the expertise of the provinces and the district. So what happens is that for each and every district, they have to establish the school health teams that will visit the schools.
Yeah.
So in city of Joburg, Ekurhuleni, so there will be school health teams. But then, like she indicated, it will be nurses from school, from local authority.
So is it that we don't have enough of those?
Yes, that is the issue of resources.
What are we doing then to up our game in that regard?
What happens is that it also impacts on the primary healthcare nurses, because the policy prescribes that if there are no teams within the vicinity, then the nearest clinic should make provision to at least visit the school. So you can appreciate that they have to abandon the services in a clinic and also cater for the schools, and the schools are many. So it's basically the issue of resources.
So there's still quite a few challenges around there.
Yes, there is.
All right. And then just quickly, the issue of the price of the HPV in private schools as compared to public schools? Yeah.
Currently, the department or the government is offering HPV vaccine for grade 4 girls in public and in special schools only. You know, it's purely for budgetary constraints and also for control. So parents are given advice to actually buy the HPV for their learners who are not in private schools,
I guess
public schools.
The sweet answer is that those that have children in private schools can probably afford the HPV vaccines, isn't that so?
Not
right,
really,
fine.
like
you don't have
she
to answer that.
indicates.
Let's cross over to Cape Town and speak to Nicole Jennings. Nicole is a nutritionist from Pharma Dynamics. Now, Nicole, we're talking nutrition at school level, and there's a whole lot. And you, as the expert, perhaps you can guide parents watching this show. Frequency of meals, perhaps. What should children be having before they come to school? What should they be having when they're at school, at home, and so on?
All right. So first of all, if I can just give some background on the situation in South Africa at the moment. We have an instance where we have a massive double burden. On the one side, we've got a massive amount of children, 28%, that are actually stunted or that didn't receive the nutrition that they needed in the first 1,000 days of their lives. And then on the other hand, we see that 2 in 10 children in South Africa are obese. So we definitely have a big issue that we need to deal with. And I think something also important to highlight is that having access to a lot of food doesn't necessarily mean that you have access to all the micronutrients that you need. So some basic tips that parents can look at is always including a wide variety of fruit and vegetables in meals. It's extremely important for children to get all those micronutrients to enable them to learn better. And then another thing that's very important is for the caregivers or the tuck shops at schools to also play that role and to make sure that those habits are formed. Research shows that in the first 5 years of a child's life, their habits are formed in terms of their preferences and their palate when it comes to types of food. So if children aren't given access to those foods within the first 5 years of their life, odds are they're not going to take those healthy habits forward as adults.
You mentioned the issue of tuck shops, that they need to also be part of the game. I can't remember exactly how you put it. But clearly that is an issue. I mean, these outlets are run as businesses, and they will obviously have or keep stuff there that sells, like crisps, sugary fizzy drinks, and so on, all the unhealthy stuff. What is your opinion in terms of how this should be handled at school level?
Well, I think the only way really to roll out a sustainable program and to make sure that these changes are implemented across the board is for for these changes to happen at policy level, to make sure that these tuck shops can't be run as businesses if the children are given access to refined starches, to sugary soft drinks, as opposed to nutritional meals that include a lot of fruit and vegetables and all the micronutrients they need in order to develop their cognitive and their physical abilities. So it really, the only way to sustainably roll this out is if we make these changes at policy level and if we start to police these tuck shops to make sure it's rolled out. It cannot be left in the hands of children to make these decisions for themselves. Of course, children will opt for sweet treats and sugary snacks if they have the option. So it really is the role of the caregivers, of government, and of the parents to take action and to make sure that healthy, nutritious options are available.
Okay. Well, Nicole Jennings, unfortunately, this is all the time we have for you. And I promise you next time, because, you know, whenever we talk nutrition, obviously, you know, there's a lot more to talk about. And next time we'll devote a whole program just on nutrition. But thank you so much for your time. Okay, well, guys, that's all we have in this segment. We've run out of time, unfortunately. We're going for a quick commercial break. When we come back, we complete our discussion on school health. Please stay with us. Welcome back, and thank you so much for staying with us. We're talking school health with my guests, Feni Mutwane, Deputy Director, IHSP from the National Department of Health, Professor Cooper, Head of Department, retired Head of Department of Pediatrics and Child Health at Wits University. And we're now joined by Dr. Tsapiso Matenji, who is an educational psychologist based in Johannesburg. Welcome to Health Talk.
Thank you, sir.
All right. We're going to come back to you because we've had lots of questions on learning difficulties and so on. But before that, Feni, maybe let me come back. We had this question around, you know, tuck shops and all of that. You wanted to give a comment in terms of, you know, regulations and, you know, how that, you know, issue of tuck shops keeping unhealthy stuff is concerned.
Yes, thank you for that. I just wanted to reflect back on the National School Nutrition Program guidelines that is being published by the Department of Basic Education. It's actually their expertise. So it clearly outlines the involvement of the school governing body, the parents, and the learners and the tech shop themselves. So they have to have the database of all the school vendors. No person should just come and set up a facility outside the school. They have to know who they are, they have to register them and actually monitor what they're selling out there. Okay. But of course, like we know, they will sneak their fizzy drinks and the chips and whatever because that is the stuff that sells. But then they need to be regulated by the school management team and the school-based support team. Yeah.
Of course, policing will be an issue there. All right, so we have, I believe, on the line, Moses, one of the callers that called us last week with some problem. Moses, welcome back to Health Talk.
Yes, good day. Last week you cut me off, but then I've been called to continue with the question this week.
Yes, my apologies for cutting you off because I wanted you to call this week, yeah?
Yeah.
So your question, please?
Yeah, my concern is that, you know, I've got this son who's been assessed by the psychologist at the primary school.
Right.
And, you know, he was placed at a special school, and he refused to go to a special school because he was declared, you know, progressive. So as a result, he went to the normal school. Then now I removed him, I placed him somewhere. My concern is that, you know, during the year, the progress is very slow. He only is competent at the end of the year, but during the 3 first trimesters, he's not competent, you know, and that is a concern to me. My question basically is that, is the child displaced or what?
Okay, just one thing I need to clear. Did you say that who refused the child to go to that school that was recommended?
No, the child decided himself that, you know, he's not going to a special school because he has progressed to the next level.
Okay. All right. Thank you very much for your question. Let's hear what Dr. Matenji has for us, yeah?
And the Dr. Moses, thank you for your call. I hope you're able to listen and maybe they can give him my numbers to have more discussion afterwards.
Yeah.
Firstly, your role as a parent is very important. When you consult a professional to find out what your child's learning difficulties are, there's a level of responsibility that you have as a parent to not just seek the professional help, but also to implement it. And that professional is there to walk you through the journey. And if they are not, request for it, because that's part of the service you require as a parent to be able to say, now what do I need to do? Why I mentioned then Dr. Moses is that part of that assessment would have told you why this child requires placement in a special school. Secondly, what type of interventions they require and what type of support programs the teachers need to provide. When you choose a school and you recommend a school, it's based on the needs of the child, not the child's whims, if I can put it that way. So it's a very calculated decision, and it's intended to make sure that the school where you're taking the child is going to address those needs, and they'll be able to monitor and progress, because you need specialized training as a teacher to deal with a child with special needs education.
But in this instance, it's apparent that it's the child that decided, I'm not going to go to that school.
So there's a problem between the role of the child and the parent.
Right.
So basically the child doesn't have a parent.
Okay. Well, it's a bit harsh to put it like that. But
I need to put it that way because what has happened is that the academic year is ending and we're having a child who's not progressing. Cumulatively, when your child has got learning difficulties, that year, that academic year where they are not learning meaningfully, they are regressing even further. And then we are wasting even more of their time because age is going on.
Okay. Earlier we had a call from Gus who said, you know, he's got a bit of a difficulty with his children. I'm sure you're listening, that, you know, with learning difficulties, especially towards the end of the year or close to exams, yeah?
So the first part I heard is that he's got an older child who has been promoted from one grade to another. But what has happened is that now where the child is, he's not able to perform. And unfortunately, you find that if there's a gap that is cumulatively going over many years, that child is going to struggle with the subsequent grades. And then we actually need to look at what kind of remedial intervention they require. And if the remediation that they require is more than 2 years, you may find that they actually need to be put in a vocation-oriented or a remedial school. So mainstream school is no longer suitable. Where you are finding that you have another child who's older, who's struggling with exams. The way that I want to put it to you, that the course is that if it's because of anxiety, we need to understand what is it about this child that makes them shut down during the exams. Are they ill-prepared for the exams? They don't know how to take exams and prepare exams properly? Is it because of their understanding, their comprehension, and therefore their level of knowledge with regards to the cognitive demands of the subjects? Is it on par? Or is it an issue with just anxiety that we have to address that? So we look at it in terms of different things. There are concessions that if you seek a psychologist intervention, they can help you in terms of where a child has got anxiety. Maybe it is anxiety-provoking and also there's distractions in the classroom. They can write in a separate venue. Maybe the child has attention deficit or they've got some emotional issues. They need to be able to give an extra support. Sometimes it's because the child has a learning difficulty. It hasn't been diagnosed. And as a result, the assessment is anxiety-provoking because those difficulties are now becoming a barrier for the child to demonstrate what they have learned in an assessment setting. And in that case, we need a psychologist to recommend that concessions, where it means they get a reader, a scribe, write in a separate venue, use a computer, or those types of accommodations. But we need an assessment to indicate it.
All right. Prof, I want us to talk a little bit about this ADHD because, you know, she mentioned it. I want your views on whether or not this is an overdiagnosed condition. There are, in fact, some people that are even questioning existence of ADHD. But before that, let's take Dries on the line from Pretoria. Dries, welcome.
Yes, good afternoon.
Afternoon, sir.
I'm calling from Pretoria.
Right.
My question and statement is, I adopted a little girl and I've put her in a private school.
Right.
This is grade R and grade 1. So at the end of the year at grade 1, we decided to, and the school decided to keep her back in grade 1 again. So she did grade 1 over, and then grade 2, we took her to a provincial school. And this year, we took her out of the provincial school by taking her back to the private school because we thought she's a little bit behind. And when we wrote in the private school again, they evaluated her, and according to them, she is not ready to go to grade 3.
Okay.
So he suggested that we should go to grade 2 again for a couple of hours a day, and then take her back to in grade 3.
It looks like it's been back and forth with this child.
Correct.
Yeah.
And she's getting 10 now. She's getting 10, and my concern is what is it going to do to her as a person?
Yeah.
And I just feel, well, I do not know, but I've got something about provincial schools. The reason why I did not take her back is I called the teacher, and at first there were 38 children in the class, then they became 46. And it just went up. So
right.
that's why I
thank
took
you so
it out.
much. Thank you so much for your question. Let's hear what the experts say. Let's start with Dr. Matenchi.
Thank you, Dr. Dries. There's a couple of things. Unfortunately, when you're changing a child from, if I can say, government school to a private school, just be aware that for some of the schools, the standard of education is different. And if ever there's a standard in terms of the curriculum, when the child transitions back, they may struggle because they are actually not on par with the other learners. Secondly, when you choose as a parent to do grade retention, beware that whatever it is that's going to be done to the child when they're repeating the year, there's going to be remediation offered. To repeat the year with no change in how the child is being taught is not sufficient.
Unfortunately, we're out of time. What should he do?
He should seek a psychologist to do an assessment and then look at what the child needs and then advocate for the child in the school in terms of how they're going to address the learning gaps that are there, because it sounds like there are.
Okay, Prof, we don't have time to go over that. Just a quick wrap-up from you, 30 seconds, in terms of school health, generally.
Yeah, I think the school must play a very important part in the overall health of the child, not only for the time that they're at school, but I think particularly in terms of nutrition, for setting habits that are going to take them into adulthood and maintain their health through adulthood.
Okay, Fanny, your last word, 20 seconds. I'm making it short.
From my side, I actually want to urge parents to participate in the integrated school health program that is offered by government by signing consent forms, because they are issued at the beginning of the year and they are valid for the rest of the year, so that when the nurses are there, then they can be assessed and receive the necessary attention they deserve.
To all of you, my guests, I'm not going to single you out because I've run out of time. I want to thank you so much for your time, and it's been really, really a good discussion. Well, folks, that's all we have for you, and thank you so much for being part of the show with your questions and tweets and so on. And we'll see you next week, same time on SABC. And remember that if you missed any of our shows, you can always get them on the YouTube channel. I'm Dr. Solomon Dangu. In the meantime, please do take care.